Hey, everybody. Hello, hello. Welcome to Understanding Pain 101, what your doctor does not have time to tell you. My name is Dina. And today I will be taking you through the fundamentals, or at least the really important stuff that helps to get you started on your path forward to changing or pivoting your relationship with pain, or at least the pain and the lived experience with pain. So bear with me for a second while I just get my screen all up here and ready to go. Okay. So welcome. What do I do? Well, as a chronic pain coach, educator, and curator, my job is to help pull the pieces of the pain puzzle together through education, self-discovery, and informed choices, essentially bridging the gap between our current healthcare model and you, the chronic pain warrior. It is my mission to expand your understanding of pain in the hopes of filling in some of the gaps, and there are gaps, lots of gaps, to bridge the gap between you and your primary caregiver through support, through awareness, through practice, through implementation, all these different things. To put back some of the power in your court by becoming your own self-advocate with a deeper understanding of how pain works and where it comes from, and to help change the narrative of pain management. So, disclaimer here, this information is not to be used as medical advice, but rather to complement the advice you are currently getting from your primary caregiver. So much of the information, actually all of the information I'm giving you is coming from all the research that's happening in the last 12 plus years, and it's pretty darn exciting. We are on the cusp of some really big things. One of the researchers that I follow is, and there's many, is Lorimer Moseley and David Butler out of Australia. And one of their expressions is no pain equals no gain. So we're sort of flipping that no pain, no gain thing on its head. When you understand a little bit more about what's going on with your pain, then you're able to use that information and make informed decisions around your care. So it's a gain, it's a win. And what are your reasons for being here today? So, if we were sitting in a room together, I would love to ask you this question. Why are you here? Maybe it's because you're curious about learning more. Maybe it's because you're tired of what's really going on in your chronic pain management currently. Maybe you're not quite seeing the results you had hoped for. So many reasons. Maybe you're here because you support a loved one who lives with chronic pain and you want to learn more. So it is my hope that we're going to just give you enough of the fundamentals today to at least get you started. Now, my next question would be, where are you on your learning journey? Are you just getting started? Are you just getting curious? Is that door to possibilities kind of just starting to open a crack for you to understand what the possibilities are around your capabilities, what you're able to do to sort of manage the pain differently? Maybe you've been reading into this for quite some time and you need validation that you're on the right path. So many different reasons why you might be here and where you might be on your learning journey. I do know that coaches are often the last stop on the path to changing things up, only because not a lot of people know what a pain coach is, but also because our first stop is the medical model, which it should be. Absolutely. We want to make sure we're ruling out any red flags. But then beyond that, feel like you're not necessarily getting the results you want, or you're feeling really stuck. And that's when, it's my job to come in. Regardless, I am really glad you're here because curiosity and learning are critical allies in the search for why you hurt. The more you are curious, the more you remain curious and open to learning, the more transformational it really can be. So I'm going to introduce you really quickly to Barb. Barb came to me about 2 years ago, and just like thousands of our other chronic pain community members, Barb was feeling very stuck in her pain. Truly isolated. She was couch-bound day in, day out. She was feeling a deep sense of loss of purpose, which I know so many of you can resonate with. But she was also determined to learn more, but was unsure of where to look. And she will also tell you openly and honestly that she was just really angry, wasn't getting the answers she needed, was hearing all these big, scary words that made no sense to her. And so she went on a learning journey. And now, I'm proud to say, Barb still lives with pain. Good, of course, for most of us, we're going to live with pain forever. But there are good days and there are not so good days. The good days far outweigh the not so good days. She has learned that she has both a combination of acute and chronic pain and is working diligently with both through a new lens. So because she's now more aware of how to work with them, it's become a little easier. She is communicating differently with her doctor, and her doctor is now communicating differently with Barb, which is pretty exciting. And also very proud to say, Barb is now mentoring others in their pain journey through building a website, which is not easy, to blogging, to now hosting her own Facebook group. So pretty cool stuff. Okay, first, we're going to take you through the old view of pain. I know that I said this workshop will take about an hour. It's going to take a lot less than that. So if you need to get up and move around, take a stretch break, you can pause this anytime. That's the benefit of having a recorded version. And you can always come back to this whenever you're ready. Okay, so we're going to go way back to the 1600s with René Descartes. He was really the first person, a philosopher, not a medical guy, who really set forth this current model we have today. So René was really the one that believed there was this separation of the mind and body, and that one can exist without the other, which we now know is definitely not true. Everything is interconnected. And as a result, was really prevented the development of a more whole person approach to care. And interestingly enough, his version is still, unfortunately, although things are changing, much of what our medical model is based on is that separation of the two. Good things are coming. So your timing is good. All right, this old view of pain, what we thought about pain for hundreds of years was you had this incident where a nail punctured your toe, and then there was this message that would be sent up to the brain to say, ouch, something's not right. And then this message would come back down to the foot, from the brain to say, okay, let's do something about this. Let's get that thing out of there, or let's stop what we're doing. So that was just this simplistic communication system that they thought was pain. So the old view of pain was that the simplistic message that pain was a detector. So, the pain was really just detecting that something was wrong. And it really, to this day, still drives our medical system and how we treat pain. The gaps that we are seeing as a result of that, still relying on that old view of pain, is that acute pain is being addressed really well, but chronic pain is not being addressed as well. It's creating this gap where we're treating the body part and not the whole person, which can be a little reductionist. It's only addressing the biological aspect of pain when we know that it's so much more than that, and we'll get into that in a second. It's not necessarily patient or person-centered. It does not validate the lived experience. Our system just doesn't allow for our doctors to really get to know us as patients, as people. And it's based on the old science, which then leads to feelings of not being heard, feeling devalued, feeling invalidated, labeled as seekers, not being believed, having this fear of, have I done something different? Have I done more damage? Gaslighting, a relentless search for new doctors, new treatments, new fixes, and spending time and money on treatments that may or may not produce results. Okay, so of these, which one stands out the most for you? I'm going to go back. It might be one, it might be three, it might be all of them, but just know, regardless of how many it is, you're definitely not alone. This is what we're seeing across the chronic pain community, and why I think it's important that you are here learning more about your pain, because this is where it starts. So now that you can sort of see which ones really resonate with you, how does it impact your pain? So I'm going to just ask you to go inside for a moment and just see with your internal landscape, when you see those points, how does it make you feel? How does it impact your physical response to that? Is there any change in your pain? Is there anything different? Is there a tightness in your chest? Is there familiarity to it? Again, quite common. All right, so now we're going to talk a little bit more about the new view of pain. Again, just to reiterate, the old view of pain was this message that came from an injury, a nail in the foot, that would send this message all the way up to the brain, and the brain would say, hey, I have a pain in my toe. Pretty simplistic. Then we have the new view of pain, which we know to be extremely complex. It's impressive in its design, but it's complicated, and it is multi-systemed. So it is throughout our body, throughout our cells, and it involves multiple systems in the body. The new view of pain says that pain is one of the many protective mechanisms we have. Our immune system is also protective. Our nervous system is protective. Pain is integral to our survival. Pain is so effective at protecting that it compels us to do something. It's a very strong message. Pain is the brain's way of interpreting danger. This is a really important point. Hold on to this one. Pain is always, always, always biological, psychological, and social in nature. This biopsychosocial word sounds a bit scary, but it's not so bad. I'm going to break it down for you. If you envision pain being this three-legged stool, the way that we describe the biopsychosocial model is that each leg represents either the biological, the psychological, or the social component of pain. If you had a stool that only had one leg, let's say that was the biological leg, just how we treat pain now, we focus on the biological, then you really are on a very unstable surface. You would not be able to sit on that stool. It would not hold you up. So we also need to look at the psychological and the social aspect. Okay, so what are all of those? Well, the psychological part is anything to do with our thoughts, our beliefs, our memories, emotions, any sort of meaning attached to certain sensations, coping behaviors, trauma in the past. These are all lumped into the psychological side of things, anxiety, depression, all those things. The sociological side is anything to do with access to care. You know, do you live up north and don't have access to therapists, physiotherapists, physicians, because there's not enough physicians around? A culture, race, school environment, your work environment, the family you live in, you were born into, society at large. Are they understanding of pain or not? Most likely not. The environment that we live in, are you in an industrial environment, or are you out in the bush? These all impact our pain and any sort of stressors that we live in. And then, of course, there's the biological, which we know really well because you live with that on a regular basis. Those are all the treatment protocols, the diagnoses, the issues with the tissues, deficiencies, all those things that have to do with our biology. So we've come a long way from the old view on the left to now understanding pain much differently to this modern view. The problem is this information is just not getting to our chronic pain community. So how do we know all of this to be true? Well, modern neurophysiology, brain imaging, immunology, psychology, pain sciences, and thousands of people's pain stories are helping to paint a much clearer picture of what pain is and how to best manage it in conjunction with our current protocols of medication, etc. So I'm hoping you're starting to get a little more awareness that this is bigger. It's a bigger picture than perhaps, our doctors have time to tell us about. And so the gaps that we're seeing now as a result of understanding that there is a new version of pain is that not all doctors are chronic pain informed. On average, they get anywhere from 0 to 12 hours of mandatory pain curriculum. And so sometimes when they're trying to explain what is happening with your pain, they sometimes sound dismissive. Might also be saying it's all in your head, or at least that's what you're hearing. So there's lots of information on the internet, but it's overwhelming and often very clinical and doomsday-ish. So we have some gaps to fill, absolutely. We also know that some of the gaps we're seeing with our new model pain is that recovery is not a quick fix and thus requires learning different skills, because pills don't teach skills. Does not address the losses, the emotional pain, the lived experience, and research is not getting to those who need it most. So if I can just go back to the first point for a minute here. We're not saying that a slower recovery is a gap. What we're saying is there's not enough processes in place, or not enough education in place, not enough programming in place to really help people get from understanding what pain is to how then to, actually shift their pain. So there's a big gap there to fill. But that's what we're doing. It reminds me of one of my favorite movies, The Raiders of the Lost Ark, where they did all of this work, the research that went into it, the adventures that went into it to find this ark. And then when they have it, they just sort of put it away in a box to be archived, never to be shared with those who perhaps could really use it. That's what's going on with all this research around pain. And there's been some amazing research. It's just not filtering down to those who need it most. Hence why you're here, which leads to a real feeling of throwing spaghetti at the wall to really see what sticks when it comes to your care. Searching Dr. Google, Facebook groups, friends, or information on pain. Feeling like you're left to your own devices, feeling adrift and alone, and unfortunately, feeling stuck. So with this new view of pain, we know it's much more complex than originally thought, that the body and the brain are one and cannot be separated, and that pain is processed in multiple systems, in multiple locations throughout the brain and the body. With the new view of pain also comes a broader view of treatment. So we need to treat the systems, not just that part of your body that hurts. We need to treat the emotional, the physical, and the environment because they all impact pain. We need to treat the whole person, not just the parts. And medical treatment alone is not enough. And this is where the power lies. You work with your doctor, absolutely, yes. But then you become an important part of this equation. And that's where self-care management really comes in, where you're learning how to do these skills, how pain changes behaviors and how we can change them back. It's like there's so many things that we can do as part of the equation. And we want to include current pain science, an understanding of the whole person, and a clear plan forward and accountability for best outcomes. So that's really what the equation should look like. And now for John's story. So John came to me a few years ago, and he was a great example for many reasons. So before we connected, John was feeling, again, very common theme here, stuck in his pain, could only focus on the pain. We get so good at focusing on the pain that it becomes a skill that we're really good at, and that's all we can focus on is the pain. Pain was amplified with each visit to his mother's house, which I'll explain in a moment. He was feeling really socially isolated, which then amplified the pain. And he was missing the thing he loved the most, which was playing golf. From a guy that went to playing golf almost every day to being on the couch, that's a huge, huge difference, a huge change. And the reason why he was feeling the pain when he would go to visit his mother, he has a loving relationship with his mother, but the association with the passing of his father, which was very painful for him, was brought up every time he went through that door to see his mom. And so we worked through many of those issues as well. So the more aware he became of what the triggers were and how to work with them, he can now really mitigate the pain or manage the pain much differently and a much healthier manner. And so now he's doing meaningful movement related to golf. He's back on the course again. He is purposeful work on his terms. He's finding his value, his purpose again by, started up another company. By reestablishing meaningful connections in his new work venture, we discovered that that was one thing that was really important to him, was feeling like he had lost out on those connections. And he uses strategies to cope while visiting his mom. Shifting gears a little bit here. What is education? I want to just introduce to you a very broad concept of what is education. And I love this. Education is the wise, hopeful, skilled, and respectful facilitation of learning undertaken in the belief that all should have the chance to share in life. Really, for much of our world, education is the way out of poverty. Education is the way out of a job that you're not happy with. Education is the way out of a certain mindset. that might be holding you back. And the same is true for pain. Once we truly learn and are aware of what pain is, how it works, how it's affected our patterns, what our patterns are, then we can really start to shift. So the case for pain education, I'm going to go through this quickly because I don't want it to be overwhelming, but I just want you to understand there is research happening about pain education. The numbers used in pain research generally are an attempt to understand the safety and effectiveness of treatment options. And it applies for physiotherapy, this applies for drug protocols, you name it. So they really want to understand the numbers. There's two numbers that we know about or we focus on. There's this NNT, which is the number needed to treat. This statistic tells us how good a treatment is at achieving a desired effect. And then there's the NNH, which is a number needed to harm. Again, this statistic is measuring for harm associated with medications. So it's important to understand how much risk is involved in any treatment, right? So I won't go into details here, but the number needed to treat, the lower the better. A 1 would mean it's great for everybody. The number needed to harm, the higher the number, the better. So NNE is the number needed to educate. So the aim for pain education is 1, that it's effective for everyone. There are no side effects. There are some positive studies coming out saying that when people understand or know a little bit about pain, they are able to change a little bit or a lot the amount of pain they feel and are changing the lived experience with pain. So pain education is actually a really crucial part. Okay, little check-in time. Where is it that you learn about pain? Where do you go to find out your information about pain? Lots of different places to learn, but that's the reason I'm excited you're here today, because this is a good chance to filter down some of the research to you. Okay, so we're going to go through some pain facts. Pain fact number 1, pain protects us and promotes healing. This is important. If you forget everything else that I've said, but you remember this one thing, pain protects us and promotes healing. For some of you, that might be a bit of a head scratcher because the word protect is might be something you've not heard, but pain truly does protect us and promotes healing, and it happens right away. Let me talk about that. So for protecting, again, another physical example, someone hurt their hand because they got a nail lodged in their hand. And that response, that automatic response of your body is to pull away from the source or to go seek help or to wrap it or to put something on it so you don't get that bacterial infection. The automatic response is to protect. And that pain is the very first cue or signal to make that protection happen. Pain is one of the many protective mechanisms we have. You recognize this slide. We talked about it before, but this is just to reiterate. Pain is integral to our survival. Pain is so effective at protecting that it compels us to do something like go to the doctor or put a bandage on it or clean it out or not use it. All these things are protective mechanisms or protective measures, pardon me. And pain is the brain's way of interpreting danger. Our brains, our nervous system is constantly interpreting, looking for safety cues and danger cues. It is what has kept us on this planet for the thousands of years that we've been here. There are humans born in this world who do not have the ability to detect pain. So, as you can imagine, that can be a really scary premise, because if this little person was born with that inability to sense pain and they were curious, as they are, they go to put their hand on that hot surface and they wouldn't know to remove their hand because they don't feel the pain response, that could be a catastrophic injury. And so pain on every level is meant to protect. Now, your nervous system is an integral part of that protectiveness. And so our nervous system, like I mentioned, is always, always looking for that safety or danger cue. It is how we navigate the world around us. Again, it's that constant interpretation of safety versus danger. And it's also really responsible for helping us connect with others. Now, that can also be a protective measure as well. If you think about it, when our nervous system is detecting danger, sometimes you don't even realize it is doing it, or you don't even understand why. It can prevent you from connecting with that person. You may feel like, I don't know if I trust that person. It's pretty fascinating stuff. So your nervous system is absolutely a part of it. Now, right now, this protective measure of pain kind of correlates with the whole acute pain. So, if you do hurt your knee because you fall off a curb or something, and the pain happens right away, that's your body's way of saying, I need you to stop what you're doing right now so that we can start the healing process right away. The problem is it can get a little wonky. Pain point number 2, persistent pain or chronic pain overprotects us and prevents improvement. So now it's flipped. And I'm guessing no one's ever told you that. Or if they have, then kudos. That's amazing. We start off on the pain adventure as pain being a protector and something that instigates healing right away. But if you live with pain long enough, it becomes overprotective and it actually prevents improvement. So brain pathways are like muscles. The more we use them, the stronger they get. So here's some examples. Learning to ride a bike, learning to play the piano, growing a callus on your hand, learning to drive, getting stronger with exercise, logging onto a webinar, that takes practice too, or building immunity. So these are all things that you might start off not being really good at, but over time and with practice, you will get much better at. And our brains get really good at doing the same thing over and over again. Here are some examples of the not so good side of these brain pathways being like muscles in the sense that they get really good. Getting weaker with bed rest, shallow breathing, wincing in pain, avoiding meaningful connections, moving less, focusing on the pain, avoiding getting out. So again, these are all things that we've gotten really good at because pain is such a strong voice, so to speak, that it really compels us to do things. And so the more we do it, the better we get at it. When the pain persists, the brain actually learns pain. This is a big one. Truly, honestly. So this is not to say that pain is all in your head. That's not at all what we're saying. But what we are saying is that if you live with pain long enough, compelling you to behave a certain way, like avoiding, being fearful, being anxious, being overprotective, then that's the brain's way of learning pain. And this is what we call sensitization. So your nervous system has become sensitized. This overprotection, now one way of thinking about how our body is overprotecting us is like this motion detector that some people have around their houses. If you can imagine, this motion detector light goes off every time a blade of grass blows in the wind, just one blade of grass, multiply that by all the other blades of grass going off. That is what the nervous system is doing. And if you live with chronic pain, you tend to be in this overstimulated state for a very long time. And that can be really hard on the body for many, many reasons, and the emotions. When the pain persists, this sensitization that we talked about prevents improvement through avoiding things that you normally really like doing because of the pain, increased focus on the pain when you can think of nothing else but the pain, and that pain fear loop, that loop of, I think I've done more damage, so oh my gosh, it's going to get worse, and I'm not going to be able to do the things I enjoy. This loop just keeps happening. Sensing danger when really and truly we are safe, but our body's gotten so sensitized that it's now deeming most things to be unsafe. And then, of course, heightened anxiety. So many things that we can talk about here, but these are sort of the big hitters. When you live with pain long enough, your once regulated nervous system becomes dysregulated. Now, there is a lot again to say here, and I won't go into details because there's lots to talk about. However, Essentially, this dysregulated, sensitized nervous system has its ripple effect in everything we do. And so we want to be able to work with you to teach you what those states are and how to move through them, and then how to regulate them a little bit more. To give you a bit of insight as to what regulated nervous system feels like, it's when you're creative, when you're flexible, and not flexible in the touching your toes sense. I mean, flexible in how you respond to stressful situations, how you move through these nervous system states. You're engaged, you're joyful, or at least you can feel a sense of joy. You're resourceful, you're connected, you're able to problem solve a little more effectively. You're motivated to do things, and you're more responsive to treatment outcomes. This is really important. A dysregulated nervous system kind of feels like you're disorganized in your thoughts, in your day-to-day activities, and your processing. You're stuck. You're feeling really stuck, disengaged with the people around you, digestive issues, fatigue, increased pain, unmotivated to do much of anything, less responsive to treatment, and fearful. So these are pretty big deals. Now, essential pain fact number 3 and 4, are going to keep this pretty simple. Number 3, many factors influence pain, and it is bigger and broader than just that part of your body that hurts. And number 4, there are many ways to reduce pain and promote recovery. This is the hope. There are as many things you can do to help dial down that pain as there are things that will amplify your pain. And I want you to hear that one loud and proud. The missing piece of this is the awareness piece, and then also you. We need you in this equation where you are now taking back some of the control by doing some of the things to help reduce pain and promote recovery. Now, when I say recovery is different for every human being. Recovery doesn't mean recovery from pain. You may live with pain the rest of your life, but recovery means that you are taking that vacation that you've always wanted to take because you are managing your pain differently, more effectively. You are getting back to work because you feel like you are now capable of holding down a part-time or full-time job. You are reconnecting with people that you have lost touch with. Recovery comes in many forms. The word's kind of been hijacked by the medical community, but recovery comes in many forms. So if I were with you one-on-one in the room, or even in a group, I would invite you to brainstorm things that amplify your pain. And here's just sort of a snapshot of some of those things. In red, it says, what's happening to me? When you don't know what's going on inside, it can be really stressful, and that's going to amplify your pain. Stress, arguments, people not believing the pain that you live with or the life you live, focusing on the pain, lack of care, feeling like you have not been cared for properly, judgment, sitting for too long, emotions, the weather, grief, thoughts, fear, all of these things. And you'll notice most of them are not necessarily related to the biological issue. It is part of it for sure, but there's so much more involved. This is a moment to take just for a few minutes here, just to see or think through what amplifies your pain. How clear are you on what makes your pain worse? I bet you have a pretty good list already of things that you know amplify your pain, whether it be the weather, the barometric pressure, stress, lack of sleep, all those things are definitely amplifying your pain. But we can do a deeper dive and really understand what else is amplifying your pain. Okay, so how do we start to fill in these gaps? I'm hoping you are now at the point where you're realizing, okay, yeah, I'm seeing some big gaps here. Become your own expert on your pain. Learn about the new science of pain, which you did today. There's more to learn, but great start. Engage with your providers, and if they aren't able to answer your questions, then they're not necessarily chronic pain informed. So it's up to you to start doing some more research, or seeking out another physician who might be chronic pain informed. And it's okay to ask that question. It's becoming much better. Our new doctors are getting a little more training. So, you might be one of the lucky ones, but it's okay to ask that question. Learning to be open and curious about your pain through the biopsychosocial lens so that you can fully understand what amplifies your pain and what helps to calm your pain. And now that you know, I would love to know, how does it make you feel? Now that you know this information, maybe it's overwhelm, hoping it's not. Maybe it's hope. That is my wish. I really, honestly, part of my role is to help you feel a sense of hope. There are far too many people in our chronic pain community who have lost hope because they're being told there is nothing else we can do. There is nothing else they can do, but there is more that we can do. All right, so what are we doing here to fill the gaps at Pain to Possibilities? Well, this is one of the things. We want to educate as many people as possible around the new science of pain so that you guys are savvy pain, knowledgeable pain people, that you understand it, you get it from all angles, not just the lived experience, because yes, you get that. You get it, you lived with it every day, but understanding truly what's going on is the next step. I'd like to welcome you to our house, the Change Pain Academy and Kutch. Now, we teach the latest advancements in pain research, so you can become your own expert on pain, coaching to help you clearly define your path forward, all while meeting you where you are now. You're going to learn and practice strategies to help you better manage the pain so you can get back to the things you love, connect with others who, like you, are doing the work to improve their lived experience with pain, create meaningful relationships inside a safe, inclusive space by warriors for warriors, peer mentorship by trained warriors who were once where you are, to get you back to a life that is more hopeful, purposeful, and meaningful, despite the pain. So introducing the Change Pain Academy, where pain education, pain management skills, and meaningful connections come together, where you learn at your own pace, you ask questions, get answers, learn new skills, practice new skills, accountability, accessibility, and all inside a community that truly gets it. So if you're ready to do the work, and you need to be ready, because this is not a quick fix, this is not a pill, this is a growth, transformational experience. We're here to help move you forward. I am pleased and proud to say that we have two distinct paths that you can take to really help move you forward. The first path I'm going to introduce you to is important because what it does is it's what we call our growth membership. I'm going to tell you what's in it, and then I'm going to tell you why we start with this. First of all, the growth membership is full access to the roadmap content. That's where you are doing your self-paced learning about sort of the background around it and then how to apply it. You also have your workbook, which will really, truly help you implement these new skill sets. You will have live co-regulating sessions, which is very much about practice and co-regulating at the same time, which I'll explain in a moment. We have our powerful Kutch community where we can celebrate wins together, lean on each other, ask questions, get support, that kind of idea. And all of this is just $7 a month. It is the most cost-effective way I can think of to help move you forward. Now, the reason why we start with the growth membership is because when you live with chronic pain, your nervous system has three very distinct states. You've probably heard very much about the fight or flight or the freeze response. And with chronic pain, we tend to live in that zone or the freeze state. And so it is really responsible for me as a coach to start you off with that. Teach you how to move flexibly through the different states so that you can then apply all the other learnings that you'll have along the way. Any other treatment protocol that you have will have better outcomes. You will be able to just deal with the day-to-day of pain just that much better. If we didn't address the states of the nervous system first, then all the other learning becomes much more difficult. All the other treatment protocols become not so effective. So we start you off with the growth membership where you really learn simple skills and practice them in a group and on your own for these skills to really stick. Then, if you feel like you need more, we have the transformational membership, which is, again, we also have a learning path in there because I want to kind of take you on a journey of learning. We have coach community as well. We have live coaching. Live coaching is probably one of the most powerful pieces, other than the community, to really making things change and stick. We also have a curated library with everything to do with chronic pain, other than the medical side of things, anything beyond what your doctor is telling you. We have live Voxer support. If you don't know what Voxer is, it is an app actually, where it's like a mini walkie-talkie where you can reach out to me once a week just for a quick update or question or a win that you want to acknowledge, something to keep us connected. And then it's just $27 a month. It's still less than $1 a day. And they are also recurring payments where you can cancel anytime. And the reason why we do a membership model is because it is the most impactful way that I know of to be able to bring you in cost effectively to really nurture that change. So that's why we've set it up this way. If you need to know more information, you can always go to our website at pain2possibilities.com, or you can reach out to me anytime at info@paintopossibilities.com. I do this because you belong here. I do this because I want you to feel like there is hope and that there are next steps. Enough of the messaging around there's nothing more we can do, because there is. You're not being told the full truth. I really want to thank you for being here and being open and curious, because there is so much more to learn. Thank you so much for being here.